Oh, I, but in a minute could get real scary. Open your eyes. Let me tell you where we come from. Trinidad and Tobago Islands. And we not even Jamaican, but the dancehall scene, yeah, we shut down. And everything, yeah, irie. But in a minute could get real scary. Anywhere we go now, missing people on the news. And the boy them on the floor now. Blood running, can't stop it. Flow, boy gunning, small rocket. Woo, black life and a small topic. No, police outside, then not stop it. No, try tell me that is part of it. No. And I want to share with you tonight. There's still beauty in our eyes. Open your eyes. Let me start with the roots where we come from. Africa, brought to a paradise island. Bago, peaceful people, but real radical. Warrior, heart clean, pretty like a rainbow. Link up with a sister isle named Trinidad. West Indian, beat the pan, I know you know the name though. Come and take a lime and a wine for carnival. Have a lemonade and unwind in Tobago. In Tobago. Tobago, Trinidad and Tobago, Tobago, I love you so. Tobago, I love you so.
Pleasant evening, everyone. Good night and good morning if you're tuned in from any other part in any other different time zone. This evening is our fourth and final session of Turning the Tide of Crime and Violence in Tobago, a public health approach, being facilitated by Tobago CivilNet and sponsored by Eastern Credit Union. I want to thank you all for tuning in with us this evening. The first three series, which were held the last 3 Tuesdays back, began with our first conversation with Quincy Joseph, an ex-federal convict and now the founder of the youth group No Youth Left Behind, who had spoken to us passionately about crime and violence and the tax of crime and gang violence, and is it worth it? That led really nicely into our second conversation, which we had the next Tuesday with Dr. David Mohammed, who is a sociologist and founder and director of the Black Agenda Project, as well as the Kwame Ture Center. And his topic was the untold truth about society's failure to develop our youth. Significant topic because, you know, we as the society do have a responsibility to take care of that developmental process and to facilitate it, to have us living in the society we want to. That led really nicely into our session with Camille Swap the following week, who's also a psychologist with specific focus on child and adolescent development. She had a conversation with us on joyful learning as an antidote to failing, ailing, and misbehaving among the youth. And finally, this week, we are most grateful and pleased to welcome our guest for the closing session, at least in this iteration, Dr. Ulric Johnson. Dr. Ulric Johnson is a community organizer focusing on the impact of isms and violence on youth, families, and communities. He specializes in the impact of color, culture, class, character, and context on individual and group behaviors, especially as it relates to prevention, progression, and treatment of addictive behaviors. He's the founder and director of Transformative Counseling, Coaching, and Consultation, as well as the founder and director of Teens Against Gang Violence, a peer leadership youth and family program. On the flyer, you would see the host there, Chanel Felix. Thankfully, Chanel hosted the last session on my behalf as I was unable to. And thankfully, Eastern Credit Union has sponsored the entire 4-part series, and we're grateful for their support and look forward to working with this organization going forward as we continue to do our work to curate the Tobago that we would all like to see. This is a gentle reminder that this program is being put on by Tobago CivilNet. And for all of you who would love to be a part of, connect with, share your perspectives, or join Tobago CivilNet, you could check us out on our website at www.tobagocivilnet.org, or follow us on Facebook or Instagram. Shoot us a DM or a message at Tobago CivilNet. Let's all pull together. Lovely. So greetings again to everyone. My name is Xavier Edwards. I will be your host for this evening. I'm very happy to be here with all of you tuned in, both in the Zoom room and those of you who tuned in on the Facebook Live. Again, this is the 4th and final episode of our 4-part series, Turning the Tide of Crime and Violence in Tobago, a public health approach. And we're so pleased to have Dr. Ulric Johnson here with us this evening as our esteemed guest to bring this whole conversation that we've been having over the last month to a close, at least in this way, because the conversation needs to continue. Our efforts towards preventing and treating with the crime and violence situation that we're facing in Tobago must continue. So without further ado, I'd like to invite Dr. Ulric Johnson to come and share with us, and after which we'll open up the conversation to some questions from all of you all who are tuned.
Thank you, Xavier. Thank you, Tobago CivilNet, Eastern Credit Union, and my colleagues who presented previously and did a great job in really identifying some risk factors that leads to violence and gang violence in Tobago, also in Trinidad. I want to start off, though, giving a personal as well as a professional introduction. This issue of violence, not only gang violence, in Trinidad and Tobago is personal to me at many levels. I was born on the island of Trinidad and Tobago, raised in a little village called Point Commander, Carenage, where growing up back in the day, I left Trinidad at the age of 13, but I frequently came back for carnival and doing consulting work. Back then, we had a village, we had a community. You know, you have the saying, takes a village to raise a child, but it's what type of that village and what type of child you want to raise. I was grateful that back then I had a village that really I felt loved, valued, and had a sense of worth, and a mom that made me feel special. I lost my mom 5 years ago when she was 93. Just to share a little bit, I did not pass common entrance. I didn't even pass school leaving. When Camille talked about joyful learning, my experience going to Point Commander RC School was not joyful. In fact, it was traumatic. Because back then we had a form of education where children were whipped. I was pantsed. I was humiliated. I was called dumb and stupid for 13 years, not knowing that I had dyslexia. I had an eye seeing problem and a hearing problem. And that's one of the risk factors that was mentioned when Camille talked about joyful learning and an environment in school that gives a child a sense of value, a sense of safety. Dr. Muhammad talks about a curriculum that's culturally appropriate, that talks about the culture and ethnicity of the child. Not an environment that is based on what I call adultism, and racism and neocolonialism. So that form of violence, which we call community violence or interpersonal violence, affected me. But one of the protective factors, and I'll talk about this later on, was a loving mom, a loving village. And that helped me and got me interested in looking at what would make a young man who comes from that type of background, who for 13 years thought he was dumb and stupid, to end up teaching at Harvard, being a dean of a college, now a psychologist. And what could we do, or what could I do to help other folks like myself gain that sense of value? And so that's when I got into psychology. I'm a licensed mental health counselor, licensed marriage and family therapist, licensed alcohol drug counselor, licensed forensic counselor. I'm also a youth certified youth development leader. Those licenses speak to risk factors. I studied those risk factors. And while here in Boston, back in 1990, 84, 85, we were having kids die every week, average of 10 to 12 kids a week. And I came across the public health model, which applies and addresses those risk factors to the point where we, from 1993 to 1996, 3 years, we had no youth homicide, applying the public health model. Today, Boston in 2024 has been voted the second safest city in the United States in terms of gun violence and gang violence. Why? Because they've continued applying the public health model. So the issue is, what is the public health model? The public health model speaks specifically, it's in the term public health. So the public health model is a scientific, really protective, preventive method of keeping and maintaining the health of the public. Take it from a doctor who you focus on your individual health. The public health model focus on the public health, the health of the community. It's based on research, gathering data. It's not based on assumptions or perceptions or delusions, but facts. So you do the research. You find out, let's look at gang or gun violence. You do the research on guns, which we will call the host. What is this issue with guns, gun violence? You get data from the police, hospitals, schools, community, and you try to find out what the issue is. It's like a doctor doing a diagnosis. You do an assessment, you gather data about what's going on with the person. I see violence as a disease. So you try to study the disease. After you study the disease and you find out what it is, and you find out, well, wait a minute, there's certain people who are infected and certain people who are not infected. You study those two things too, which is called risk factors and preventive factors. We saw that with COVID. In terms of road deaths, at one point there was a lot of road deaths around the world. They studied the road deaths, they studied what conditions happen, and they realized, wait a minute, people were not wearing seatbelts. So they studied it. They tried, well, let's see if people wear seatbelts, if that will reduce road homicide. They tried it. It worked. It reduced it. And they said, okay, let's evaluate it. Why is it useful? Why is it preventing deaths? And the same thing we apply to gun and gang violence here in Boston. We study the gang members. We study guns. Where did it come from? How did they get it? We collect the data. And we find out, well, there's certain young folks who are not attracted to gangs. And there's folks who are not getting access to guns. What's going on there? What is the preventive, protective factors? After we find out what the protective factors is and the preventive factors, the factors that would most likely reduce a child from using a gun, killing someone, or joining a violent gang, we try it out. We try out the preventive factors. Then we gather statistics, we gather data. This is how it works, why it works. If it does work publicly in a broad sense, the next thing is to educate the community. I think each of the presenters talk about education. Nelson Mandela said education is the most powerful tool that we could use to change the world. Going back to Trinidad, when I didn't pass common entrance, it's not that I didn't want to learn, I couldn't learn. When I came to the United States, got glasses, got a hearing aid, found out I was dyslexic, I identified the issue. Education helped me. I made the honor roll, and that was a protective factor. I was in an environment where I wasn't getting beaten. I remember when me and my brothers came to the United States and the teacher says, Johnsons, come here. We automatically start sweating because we thought we were going to get flogged. We used to raise our hand to go to the bathroom, and I think that also helped us do well in school. An education system, a relationship with anybody based on fear is not a healthy relationship. And I think in Trinidad, I think in the United States, everywhere, if your relationship with the police is it fear or versus respect, if your relationship with your parents is based on fear versus respect, your teachers based on fear versus respect, even your God. I do not fear my God. I respect my God. Those things are risk factors. If you're living your life based on fear, you're most likely going to pick up a gun or join a gang to protect yourself. After we implement it and we find out it works, we then basically gather research and data on how well we work and we adjust it. So you got to adjust your intervention based on the community and the child. So we went not only from seat belts, we went to airbags to make it more effective. That's the public health model. It's always scientific. It's always based on protecting and improving the health of the community. We have applied that model here in Boston, and we put money behind it. And one of the things that we need to do is to continue doing research on what we call the host, the agent, and the environment. The host is the individual or the group that hosts the anger and the rage that will lead people to go and pick up an agent, which is the gun, which is the agent that really transfer the violence, deadly violence. And those hosts and the agent live in an environment. So we got to look at the environment as well. How does the environment support gang violence, support gun violence? One of the things that we got to look at is not just gun violence and gang violence. There's many forms of violence. You can't say that how you want to be healthy go and exercise, and still smoking and drinking. You got to look at everything holistically. So I want to talk about the issue of this 3 types of violence that's involved in the public health model in reducing gang violence overall. The first one is what we call self-directed violence. As a psychologist, I deal with gangbangers who are suicidal, who are traumatized. We have this thing, killed by police. I've dealt with gang members who have set themselves up to be killed. So self-harming behavior, suicidal behavior is an issue that's going on, is a risk factor that is going on in Trinidad and Tobago and the United States. Suicide since COVID has become one of the leading cause of death of young people here in the United States. We have kids as early as 10 years old killing themselves. That's an issue that's called self-directed. Then we have the interpersonal violence. The interpersonal violence is like family violence, violence with your partner, your family, your friends. Gang violence will be in this category of interpersonal. So you've gone from the individual to the person that you interact with. Then there's the other form of violence called collective violence, which is social violence, hate crimes, terrorism that we see. And that's a form of violence. We're seeing a rise in hate crimes and violence since our newly elected president has been in office. The sense of really hurting other people with racism, stereotypic stuff, homophobia, etc. Then the other one that I think America is, and the world is experiencing, is what we call political violence. Wars, the war in Israel, and all of those things are violence. And all of those things impact young children. I think Camille talked about development. There is a research study called ACE, children who are exposed to adverse childhood experiences. Children that we know that are exposed to violence in the home, who have been molested, who have been beaten in school or out of school, who have been bullied. We know if they have a certain amount of ACE, of 4 or more, they are heading in to gang and gun violence. So we got to use the public health approach. There's a room for the criminal justice system, but the public health, we don't lock up patients. We don't lock you up if you have a cold or you got cancer or you got diabetes. We don't lock you up. We try to find out what are the risk factors and protective factors and try to help you, okay? So, but there is room for if you're a violent patient and you want to kill some, yes, we have the criminal justice system. Crime is violence that is determined, goes against the law of the state. So that state's violence, the violence that leaves people locked up is what the state defines. Now, we have violence that is committed by politicians on an ongoing basis where they don't get locked up. So is what they define to be the solution. My concern, I think Tobago Civil Net, and my concern and the concerns of the panelists is looking at the violence that is affecting the community as a whole. And how do we address the risk factors that is associated with those violence? Some of the risk factors that was brought up in the past presentations, and it's similar to the risk factors of gang violence in the United States, in Jamaica, as Dr. Muhammad said, in England, all over the place. One of the first and most permanent risk factor that we know is poverty and economic inequality. We know that communities in Tobago and in Trinidad, where there is poverty and inequality, there is still communities in Trinidad and Tobago that don't have any electricity, that don't have any running water, much more roads, and we export pitch. It's called a culture of poverty, where people accept the fact, or the government accept the fact, hey, they ain't getting no water. In 2025, you have one of the richest islands in the Caribbean having people living in poverty and economic condition. Around the world, that's the #1 risk factor in terms of leading to gang and gun violence. Another risk factor is, of course, the access to guns. I was raised in Trinidad. We had cutlass. I remember when steel pan men sharpened their cutlass and we chopping people. Violence has always been part of nature. But as Jeffrey Canada said, we went from fists to sticks to knives, cutlass, and then guns. Changed the whole equation. You see, if Xavier did me something, if I have to fight him close quarters without a weapon, he could get at me. But if I have a gun, all I have to do is exercise that index finger. That gun brings everybody down to the same level. But as Quincy said, if you use a gun, there is some taxes. There's consequences for every behavior. But if I'm a child raised in a home where I see violence, where I see my mother getting beaten, or I go to school where I get beaten, or if I go in the community, I get beaten, and I get a gun, and I hold that gun to the biggest bully, and I see that bully, pissy pants, you can't take that gun from me. I once had a girl who was involved in a girl gang called, and I was just B with an attitude. Girl gangs are more dangerous than male gangs because they have to exercise their level of violence twice as much to prove themselves. I met her and she said, Dr. Johnson, I will leave this girl gang today if you could promise me no one will hurt me anymore. I was raped by my dad, sexual abuse by my uncle, went to multiple foster care homes where I was abused. When I joined Bitches with an Attitude, that was the name of the gang, and I told them what was going on with me, with my uncle. They came to my uncle and they told me, you touch her anymore, you will not have anything to piss with. She said, that's the first time I felt valued, loved, and protected. If you could guarantee me that level of consistency, I will leave the gang today. We need to create a community where children, even pre-birth, need to feel safe and valued. Another one that is a risk factor, and it's in Trinidad, is alcohol. We have an alcohol problem in Trinidad. And when you're drunk, you're more and have a tendency to be violent. Most gangbangers, at least in the United States and in Trinidad, I study, before they go out to create harm, they get drunk or smoke to lower their inhibition, and they go out and commit the crime. After they commit a crime, they come back and they drink to deal with the guilt factors that they have. We have seen a lot of children and women in Trinidad and Tobago experience interpersonal violence because of alcohol and drugs. The other one is that you cannot say that witnessing violence on a constant basis is not going to affect you. That's called vicarious trauma. And we see that in Tobago and in Trinidad, and we know children who are witnessing violence. By the way, I want to say there's a show in Trinidad that I can't stand. And all this guy do is show crime and violence, nothing good. But they say if it bleeds, it leads. We, in Boston, one of the protective factors that we use, we work with media to say, if a gang commit a homicide or just shooting, please don't publicize it. Don't. And so that helped in the reducing of violence. Media is very important. A lot of the lyrics, I think they have this new style of music called Trini Bad. I mean, it's like, what about Trini Good? Trini Bad? all right, that's going to affect us as well. The other thing that Camille mentioned, and I'm looking at it as a psychologist, is what we call biological organic factors. We have children who have learning disabilities or challenges, like myself, that does not get picked up or recognized, or do not get the proper treatment or diagnosis. We have a lot of children who are suffering from trauma, who do not have the proper mental health counseling. One of the reasons why I became a mental health counselor, and I specialize in male counseling, is that back in the slavery days, the master was not interested in us from our neck up. They were not interested in our thinking. They were only interested in our neck down, our bodies, and working us as animals. We got to reclaim that mental health is just as important as physical health. And I think that's the other thing. And we got to look at biological factors. We have parents now. If a woman is pregnant and is living in a hostile environment of violence, that stress, that cortisol hormone that is produced in her body goes and affects the child. Everything that she does affects the child. So we're looking at children who are born with trauma from the womb because of the environment that they live in. And it affects development, their cognitive development, as Camille talks about. The brain is still developing. Anything that interrupts the brain from fully development affects behavior. The other one that my colleagues mentioned, and is coincide with what we know as risk factors, is a culture of violence. A culture that supports violent behavior. Don't hit your brother. Don't use that language in my house. That culture that normalizes violence, interpersonal violence. Why go kill yourself then? You know, a culture that support violence, support the love of money and material stuff over oneself and another person, I can tell you, you're going to have violence. I have seen my island go from loving human beings and loving each other to loving money and loving material things here in the United States. I think that capitalism, and I think Quincy mentioned, somebody said it's not money, but the love of money that gets you into trouble. So the public health model looks at all of those factors. It looks at the environment. It looks at the host, the people who in essence carry this violence. It looks at the community and the environment that festers and allow it to grow. You cannot deal with just one aspect. You got to deal with all if we want Tobago to be the Tobago that we want it to be. And it was, and it still is. I just want to say this before I end. There is good things going on in Tobago that we need to continue doing, and there's things in Tobago that we need to start doing and stop doing. And Tobago was my first visit to Tobago was like really, I was very proud. It was an island that held on to its cultural identity. You know, it did not want to be seen as a country where it's rum, bacchanal, wine, and all of that stuff. It was one that was proud. And I think that's why then the violence was low. But violence is very infectful. It's infectious. It's a disease. And I think what happened with Tobago is like, we did not look at those protective factors and maintain it. Let me just say this. Growing up in Trinidad in Point Comana, where we did a guy up to build my sister's house, where the whole community came together and built a house for my sister and my brother-in-law, fix the roads, watch out for each other, did not take money. It took commitment, it took dedication, and it took an attitude that's on an emblem. Together we aspire, together we achieve. We got to reclaim that. We cannot rely on government because, as I will say it, Frank Kume, I want a government that think people rather than party. Same thing in the United States. They think party rather than people. That's why we have a president who, I can't say enough. We need government to think people rather than party. We need churches and communities. Everyone has to get involved in making Tobago. I like the logo, safety net. Let's pull together. That's my call for you all. That's my challenge for each Tobago person. You could contribute to ending violence and gang violence in Tobago. You could do your part from the child that cleans up his home and put his toys together, to the peer leader who will see another peer getting angry and calm him down, to a mother, rather than beat a child, talk to a child, to a teacher who will take time to learn about a person, that student in their classroom. The public health model is a scientific, protective model that's based on data in improving the health of the population. It does not discriminate. And I think that there's good work doing, like Tobago Civil Net, taking the time to put this series on, struggling. I think NGOs need to put their money where their mouth is. And the government needs to allocate money much more equally. You cannot rely on just the criminal justice. You can't lock up people. That's not going to deal with it. I call that the cockroach syndrome. You put a light on, cockroaches disappear, and you think you have no cockroach. What happens when the light goes off? They come back. So the public health model is about a permanent, consistent approach to dealing with gun and gang and crime violence in Tobago. Thanks, Xavier.
Thank you so much, Dr. Johnson. Again, everyone who's tuned in this evening to Tobago Civil Nets, turning the tide of crime and violence. This is a reminder to you all to share the live so that more people could become more aware about different ways of looking at crime and violence as opposed to just isolated incidents. Dr. Johnson is really speaking about how those incidents are conceived from as early as childhood, sometimes as early as even in the womb, by the environment that is set. And sometimes, if you don't have the information, if we don't begin to think that way, then we could miss the preventative methods that we could implement from now, like right now, for the next 15 years, the next 20 years. That would help make a difference. Thank you again, Dr. Johnson. You brought some really powerful points this evening. I think one of the first things I want to get into with you is, you mentioned that between 1993 to 1996, you saw not just a reduction, but it went to 0 murders of children in Boston.
Yes.
Correct?
Yeah.
My question is, what led to the community taking such a stance to actively put so much energy? What led to the community putting so much energy behind shifting that paradigm that was happening in your community? What led to that?
I think that's a great question. So prior to that year, I think 1984, that's when we saw a rise in gang violence. I mean, every weekend we were losing. It was like people were killing people like first time. And I think what happened, I think people began to realize that Violence doesn't discriminate. It could be your child, right? It could be, you know, your neighbor's child. And I think the major push behind it was young people. Young people, Xavier, was saying, that's when I formed Teens Against Gang Violence. They were tired because they were seeing their friends killed over stupid stuff. One child got killed because the guy looked at him. So the children then pushed the parents, and the parents pushed the community, right? From the voice of babes, right? Children lead that. So we had all these programs, youth programs, but young people were not joining them, Xavier, because they were youth programs started by adults, run by adults. What makes gangs successful? Gangs are a program started by young people, run by young people. That's why I started Teens Against Gang Violence. They had me going around talking to kids. They don't want to listen to me. They'll listen to their peers, right? Again, going back to young people. And so and then young people challenge the directors of these programs and saying, well, wait a minute. You know, like when your mother say, this is my house. I make the rules in this house. Okay, mom, it's your house.
Yeah.
Fine, I leave in, right? This is my program. When you had young people getting involved and forming the rules, the same thing. When I go to schools and they meet with the principal and said they have a gang violence issue, I said, have you talked to the young people? Yeah. Well, they say do this. I said, yeah, you do that, give me more money. I'm done. They know what to do. The other thing that made it, it's called the Boston Miracle. We had people from all over the world coming to Boston to find out what did we do. One of the things that we did, Xavier, is that rather than these different programs being in their silos and competing for money, little bit of money and funding, we came together and realized they're setting us up. They're having these youth programs operating like gangs, you know, fighting each other for money. So we came together and basically realized that we may share the same kid. Xavier, you may be coming to my program, then you go to another person's program. The police department will have interaction with you. You have 5 different people having interaction with Xavier, but these people are not coming together to take care of Xavier. You follow me? You know? So we have one child that everybody, he's going everywhere. So we came together, came out of our silos, and worked together, share information, share resources. Xavier, your program may have an event going on. Rather than compete with your event, I'll bring my young people to your event, right? And that's happening now with Steel Pan in Trinidad and Tobago. If Rado's having a party, oh God, don't give the party the same night with Rado's now. Bring your people to Rado's party. Then when you have a party, you see what I'm saying? That's what make, and up to today, that's what's happening. The same thing with churches. You know, churches are gangs, you know. Well, I do a whole presentation on gangs. Martin Luther King, the most segregated part in the week is Sunday. Everybody goes to the different gangs, right? And then the gang fight, you know? So that's what happened. I think young people drove, and I'm challenging young people in Tobago. Because when I work with young people, I said, look, the government is not interested in ending gang violence because they make money off of it. I think Dr. Muhammad talked about it, right? You have to end it. You know, so that's what got people to realize it's your friends getting killed. And it's your boyfriend, it's your girlfriend. Yeah. So that young people, yeah. Go on.
That's a really powerful point because I agree. I think that personal challenge, personal trauma, when it hits home, as they say, sometimes I will find the strength to do what you knew was necessary long before you did, but it didn't bother you. Not my problem. But I like to say that, you know, there's no what I've come to realize actually is that there is no external challenge, no matter how great the magnitude is, that could sustain that desire to improve your society, to improve yourself, to do anything. Even in the midst of an external challenge, when times pass, as they say, and the light come on, sometimes we have the habit of saying, well, okay, the problem is solved. But I think what you're speaking to, and correct me if I'm wrong here, is cultivating an environment that gives people an intrinsic desire inside of your own self. You want to see your community do better. You care not just about your own family or the children in your own home, but the whole community, the children to come. So you had mentioned shifting from a collective community-based sort of thinking to very individualistic.
Yes, moving from an individualistic, moving back to an individual, that's a major contributing factor. You know, there's something called the eco-sociological model of violence prevention, letting people realize that what you do affect another person, then affect the community, then affect the whole society. And we saw that with COVID, right? You choosing not to take the precaution and preventive factors will lead to an epidemic and a pandemic, right? So we are all connected, you know, and we're all influential. Every individual is influential.
Why do you think that the public health approach that was taken in Boston and was so successful, why do you think that approach would be applicable and work in a place like Tobago?
Because Tobago had practiced the model before. It practiced the model before. But we've been bamboozled. Back then, this is the influence that we had. First, it was parents that influenced children. Then you had church. Then you had school. Then you had peers, right? That's how the influence went. Now, media is influencing. Children are going to church anymore, not listening to teachers, right? They who control the information and the public media control the minds of people. As a cognitive behavioral therapist, what you think influences how you feel and what you do, right? I was told I was dumb and stupid. Somehow I believed it. It influenced me how I feel, did not motivate me. When I got my glasses and educated, it changed my thinking. Damn, I'm not dumb. It's just I couldn't see, right? Changed my whole thinking. That this dumb, stupid boy from Trinidad ended up being a professor at Harvard, being a dean of a college. It's the same thing with children, right? And so when you realize and you become awake, as they say, and once you see it, you cannot not see it anymore, right? I'll tell you a story. I had someone referred a young man to me because part of the violence prevention project is that we had violence prevention person in the emergency room. If a young person come in that is shot, he immediately gets services, and that violence prevention person hook him up with college, with counselors and everything. One of my colleagues met this young man named Domingo. In essence, and we had him in the courts too, was being charged for almost killing an 8-year-old, defending himself with a gun. And they referred him to me and they said, Dr. Johnson, this guy always walks with his gun. So I said, Domingo, I heard you always walk with your gun. I know you're scared. I'm scared. I'm going to meet with you, but leave the gun outside. And let's go in and talk, because I may say something to you, and you know what I'm saying? And long story short, Domingo right now is an ordained minister and is currently making a movie in Atlanta. I went to court with him, and I told the judge he was looking at getting 15 to life. I said, this kid, this young man is a brilliant young man. All he needs is an opportunity, and I will take responsibility for him. He is a professor, ordained minister, and a movie director. Every day, on that day, that court date, he called me and thanked me. He has raised, 4 boys and 2 girls. And so the research shows it only takes one loving adult to redirect a young person or a young man. And that's why I say young people, it could be you.
I'm looking at a question here from Facebook, and I think you already touched on it earlier. But it's accepting that some areas are poor and undeserving investment. How do you get those with the influence and the access to capital? And even those with influence over the significant point areas concerning the media to support that movement and care for what is happening in those quote unquote poorer and at-risk communities.
Same Domingo. When Domingo met me, he used to use gangster rap with a lot of cussing and calling women all kind of names. And I challenged him to say, like, would you have your mother listen to this? He said, no, Dr. Johnson. I'm saying, listen to what you're telling me. Would you allow your pastor to listen to this? Listen to what you're telling me. Then who is this for? Right? Who is controlling the message? Who's controlling you? So he switched from gangster rap to gospel rap and became a gospel rap artist, right? I think in terms of money, one of the risk factors to the violence prevention public health model is the lack of funding, as I mentioned earlier, to programs and having community programs fight each other for a little pool of money. Going back again, we need to come together as a community and pool the resources that we have. We challenge churches. You have a big church, lots of seats, but you have a youth program looking to a center to have a conference. Why can't they use your church? Why is your church closed up during the week and open on Sundays, right? Your church, people are paying tithes. So why can't we use the church to have a function, right? The church is not just there to be praying and whatever. It's there to serve the community. The same thing with community centers. I know my youth program, we went and we learned how to beg. And we say, look, we're doing a fundraiser. Have us just rent this stuff. If you don't want to give it to us free, give us at a discount price, right? We know in the United States, programs that works don't get funded. Programs that don't work gets funded. And it's not who you know, it's who wants to know you. I always said Harriet Tubman, Harriet Tubman, the Underground Railroad that freed a lot of slaves? Thank God she didn't write a grant proposal. It wasn't going to be funded. Any program that's about liberating the minds of Black people and oppressed people, you're not going to get funded. The oppressor, they said Willie Lynch, slave master in Jamaica who studied mind control, he says, jealousy and envy is more powerful than love and admiration in keeping Black people separate. And boy, do we Trinidad and Tobago jealous and envy each other rather than love and admire.
Powerful. And, tuning back into that jealousy and that envy and that antagonistic nature and that antagonistic approach that we see at so many levels. We have another question coming in from Facebook, and a reminder to everyone tuned in, if anything you want to ask Dr. Johnson or any thoughts you might have about anything we're discussing, feel free to post it in the
please
comments.
Post it.
And remember to share the live as well. The question is, do you think that young children and youth can see that division in the society amongst the various religious institutions, or let's say the political parties, the major ones? And if so, how do you think that then affects them and how they approach going forward.
It's the same way that violence affects them. When they see their mom and their dad fighting each other and disrespecting each other, that's a form of emotional violence. It's not just physical violence. And that child takes that in, developmentally takes it, and sometimes blame themselves for it. So it does affect. Children live what they learn and learn what they live. They see things, they take it in. Just like that unborn child in the stomach. The mother will think, or the father or the boyfriend may think that what he's doing, even the music, the baby is listening to the music, studies have shown, right?
Yeah.
That neurological brain is developing. All of those environmental behavior affects the child. So there is no accident that children who are raised in abusive home end up being abusive husbands and wives. Because neural pathways is formed, right? You know, you got to control your woman, man. You got to control her. Hey, your woman, boy. Let me share a story. When I got my doctoral degree and I came to Trinidad to go to that teacher who called me a dirty dog because I was still looking for approval. I still loved her. To say, look, I'm not stupid. And she just saw it and was like, okay, great. But what shocked me, I was walking down Port of Spain, and in Woodford Square, I saw a man beating, I don't know if it's his wife or beating a woman, and rip her clothes off, and she was naked. In Woodford Square, and the police station is right there. I saw a police officer walking by saying, aha, he's going to do something. He just said, give her back her clothes and continue walking. If a child sees that, that's a traumatic experience. That's witnessing violence. And that's witnessing a man beating a woman and ripping her clothes off, and yet the police officer who was supposed to intervene did not. That's going to affect that child.
Yeah.
It affected me up to today.
Yeah. Yeah, for sure. And you mentioned the how, as you said, the media, the experiences, the whole environment, it shapes and sets the child on a path and sets the whole community, because, you know, we talk about children so much without realizing that, you know, the same music the adults listening to with their fully developed brain, the same shows they're watching, the same things that we let slide, is also influencing the way we see it. Been a desensitization over time to situations like the one you just described, which is so extreme, but at the same time, you know, so much of the shows and the music makes it normal.
Yep.
You know,
Well,
normal.
We have young people, rather than intervening with a fight, take out their what? They take out their phone and take a picture.
Yes.
Right?
Yeah.
That's a desensitization, a normalization of the violence. You know?
And it's important. It's important, everything that you're sharing with us this evening, and every opportunity that any platform, whether it's Tobago CivilNet, whether it's any of the other NGOs that do work, whether it's you yourself, Dr. Johnson, in your work, share the information and put it out, because sometimes it's just the opportunity to interact with something that allows you to think differently that we don't have enough of.
Right.
So this is not to count all the work that already is done, but is to encourage everyone who's doing the work, because
continue to do it.
I continue doing it because I look at even my journey as a young man growing up, the same challenges that I face now. Even though we didn't have as much access to the internet, we had TV, I had BT, I had MTV, you know. The same challenges, the materialism, the ideas of success, or what it means to be a man, or what it means to be successful and to drive a nice car and to have money by any means necessary. All those ideas was ideas that floated into my reality too, like everybody else. And in a significant way, you know, significantly shaped the way I looked at the whole world, the way I looked at the woman, the way I looked at myself, and the way I valued myself, my self-esteem. You know, you spoke about people telling you things when you were small, like, you know, and not realizing. But there was an awakening. There was some introspection, some blooming into realizing, well, no, I can't let that define me. I cannot let that define think. And I have to give gratitude because I'm an artist by profession. I chose to do music as my medium to add value to the world, you know. And now I'm a businessman. I do cold press drinks and smoothies and things to heal in a different way. But what I'm saying is, if it wasn't for those who, like the Erica Badu's or the Shadow, who, even in the midst of everything else,
Yes.
put themselves forward, said what they thought, questioned the status quo,
Yes.
argue with
Yes.
the government,
Yes.
question, just be bold and brave, that helped to give me an opportunity to say, oh, okay, well, I could think that way. I could use that kind of perspective and then chart my own way forward.
Right.
So,
Right.
you know, for the media, I just want to really, really endorse that point 100%. You know, the media taking responsibility and accountability for how responsible they are for helping to shape the minds of the future.
Yeah, artists like yourself, I have a big issue and I call them out. Same thing with gangster rap. I haven't done a shite for anybody in the United States, but promote violence. Conscious lyrics do not make it on the radio station, right? Only music that promote violence and the culture of violence makes it, right? And so you said like we have to be brave and realize that one of the things we try to do in Trinidad was get these popular artists to do violence prevention commercials, and they refuse. They refuse, you know, because they have that image to keep, right? And you just know that media and art is one of the most powerful influence. If we could get artists to sing conscious lyrics, or if not, but you see, a lot of them don't want to be what I call hypocrite, talking shite and being hypocritical, is that if you are going to do a violence prevention ad, you must be consistent. You can't do a violence prevention ad and then go back to your same violence promoting music. You know, the young people will look at you as a fake, right? And so a lot of them choose to just go this direction. That's why I challenged Domingo. It's like, are you gonna be gangster rap? And you go Christian? And he realized he's tried gospel rap and he became famous. He's had multiple awards. You know, so yeah. I mean,
major point here, I just want to take a quick detour. One of our audience members signed into the Zoom room, wants to speak. That's George Bob. He's also a member of the Tobago Civil Net.
okay.
George, if you're online, I'll open up the line and you can come in and ask your question directly.
Okay, you hear me?
Yes.
Yes, we're hearing you loud and clear.
Okay, Dr. Johnson, you're a very, very interesting topic I'm following. I just want to deal with this issue of public health problem from a different angle. I suspect anything that contributes to social, psychological, physical, and mental illness contributes to a public health problem. Okay. Now, Sigmund Freud is a guy who says sex is the most dominant instinct. But you had a guy called Alfred Adler who said the most dominant instinct is the one that drives you to be upfront. You know, and I think Martin Luther King dealt with it when he was talking about the drum major when he says that, of course, you know, the drum major is the fellow who is always up front and leading the parade, that is always, so so you have this natural instinct, which leads to, and it's natural, and when you have natural instinct, they are generally unpredictable and complex. But so you have this instinct leads to all sorts of things in terms of being above, being racism, supremacy, violence, keep up with it, a set of negatives, okay? And when you add that to something that a guy called Henry Adams said, that chaos is the law of nature, then you have a real problem, okay? How do you harness this natural instinct, this drum major instinct, preventing it from contributing to the total deterioration of the society, and everybody climbing on top of everybody else and want to be better than everybody else, you want to compete with the Joneses, etc., etc. How do you harness this and tame it in the interest of a better society?
Very good question. Sigmund Freud also mentioned the id, the superego, and the ego. The id is, that talk to that instinct to joy, but he also addressed the superego and the ego that keep that id in control, right? So we have to develop systems and relationships that will control we have different instincts. We have you also mentioned the animal and the animals, the instinct to die or live. Which you feeds more is going to dominate, right? Now, if you have a child live in an environment that is so violent and painful, that's feeding the instinct to die. That's why we have young gang members who don't give a damn if they die, because dying is a relief. African proverb says we pray for the dead, we celebrate the dead and pray for the living, because the living is dealing with a lot of pain. The self-harming that I talk about, I've dealt with gang members after the hoopla and the celebration are crying, have nightmares. When death becomes more attractive than living, that is not the individual, that's our collective responsibility. Because the God that I know wants whatever he creates to remain alive and reach their full potential. But there's other forces that would like to kill that. If we choose to allow it to happen to us, for whatever reason, collectively or individually, that's a responsibility we have to take. Yes, sex is one of the driving forces of living, but love and belonging, a sense of safety, a sense of self-actualization, as Maslow talked about, is also an instinct that all human beings have. And we have to make room for that. I think if you live in a society that pay more attention, both financially, in terms of time and energy, of really feeding one instinct over the other, like rum, wine, and jam, and you'll learn. I'm here in Boston trying to bring back traditional carnival. And I typed in carnival in Google, and what came up was skimpy outfits, not the traditional costume. G-strings and all kind of stuff, right? A costume that you could get in an envelope, right? That's how the media is controlling and defining us. I think one of the things that I'm not going to minimize that instinct, but as Freud says, as a psychoanalyst, is that it's my job to really represent the ego, which is the rational brain, and the superego, which is the brain, the instinct that really is connected to morality. If we give up morality, that instinct for morality and order, for the one of just fun, we are off balance. That's why it's called a mental disorder. You're out of order. We got to get back to balance. Too much fun could kill you. Just as too much violence could kill you as well. So yes, I think the way to do that is we need to get back to a defined cultural morality. When I was growing up, you don't pass an elderly person without saying good morning. That's simple, is fighting the instinct to say, hold you up, right? We had church and community that feed and keep that instinct to go wild. You know, so I think, I don't know if that answers your question. I saw somebody have a hand up.
Yes, Dr. Johnson, Camille, how
Hi,
are you?
Camille.
Good evening to everybody. I'm very passionate about the discussion and thank you for raising all the points that you have raised and I heard you in 2008. What I'm hoping Tobago will do, I am really not understanding if the populace in Tobago, Jamaica, Trinidad and Tobago, if we understand that each one of us we have a part to play, right? And what concerns me is from Jamaica, from I was in my teen years, and when violence just started in Jamaica, we kept saying the family, the family, the family. Now I understand that the family has a role. Why I'm excited about when I first heard you, Dr. Ulric Johnson, speak about the public health approach. I would have then, after hearing you in 2008, just present it in Trinidad. When you were in Trinidad, you presented it. I would have gone to Jamaica in 2014 and the party in power then brought a foreigner in and they spoke about it and I didn't see anything happen. I didn't see any news, anything. I came to Trinidad and about 2 years ago, if I'm not correct, my prime minister came here and the prime minister here and they were talking of public health approach and I didn't hear anything after that. So I'm really hoping that the populace and the people who are listening to you today and hearing you speak will talk to their friends, their community members, people they know, we're small countries, and say, we want this approach. And why should we have this approach? And why should Tobago, the question was, why should Tobago take this approach? We took it for COVID, we took it for AIDS, we took it for diabetes, we need it for violence because violence is our urgent factor. And why I'm excited about it is that we will look at the family, but the school system in Jamaica and Trinidad and Tobago will look at themselves and say, before people were parents, they were broken to in the school system, and then they became parents, and then they were also at risk for being bad parents. Because international research now, even in Finland, is looking at low academic achievement. When a person feels I failed, I'm not good, it pushes them into mental anger, low self-esteem, and mental ill health, and then a propensity towards that can lead to violence. So I'm saying to everybody, we need to support Tobago Civil Net pushing this forward. Dr. Ulric Johnson, who is man of the soil, who has tell you in Boston it works. We need to, as a populace, say to other leaders, why can't he be on that team? Why can't he be hired towards this? Because our urgent item is to go out, walk from our cars any time of night and be safe, and our children be safe.
Yep.
Thank you. Thank you for your contributions. It's a
welcome.
common sense approach to lowering violence.
But you know, as they say, common sense is very uncommon these days.
Very uncommon.
I tried selling common sense on Amazon and they won't even buy it.
Thank you so much, both to me and to Brother George for their questions. I just have another question coming in from Facebook. If finding funding from the state is limited and possibly blocked by unseen forces for this kind of developmental work, how do we then find funding or even creative ways and means to find funding? And I would just like to add to that question a little bit, funding and energy, because the energy is not always finance, but the energy to execute.
Do you know, I was just reading, Black Americans spend over $170 million on hair, false hair. We have the money. People will you ever heard about Susu? People will save their money to buy a costume, to go to all exclusive fete. We have the money in the community. What do we choose to use that money for, right? If Tobago SilverNet is giving a fundraising party to address gang violence, the same money you will pay to go see some Marshall Montano and whoever. I speaking frank. It's hypocrite. I mean, we have the money in the community. I have never seen so much nails in women in Trinidad. False eyelashes. We shave out our hair to wear horse hair and pay money for it. If we use our little pocket money, right, to fund Tobago SilverNet or youth program, give it to them. You know, we have, and so Black people around the world is the richest people in the world, but we give it away. So an oppressive government, wherever it is not going to pay to liberate the oppressed. Stokely Carmichael talked about that a long time ago. Frank Fanon talked about blackface, white mask. Okay? Professor Henry Clark says, I don't need a white man in government if I already train Black people with the mentality of the white man to be in government. And as they say, all skin folk and kin folk, you know? So the question is that we cannot, as I told you earlier, I tell young people and gang violence members, they do not want to stop gang violence here in the United States. I have a solution to ending gang violence around the world.
Let's go.
I told gang violence members, take out a life insurance policy. Take out a life insurance policy. Insurance company is going to make sure you remain alive because they want to keep that money. You see what I'm saying? If all the gang members I deal with, I said the one thing you could do, take out a life insurance policy. Soldiers don't take out life insurance policies, right? The government is not going to require you to take out a life insurance policy and send you to war. It will show the insurance country out of business, right?
Yeah.
Money talks, bullshit walks. If all gangbangers listening to me now in Trinidad and Tobago, all gangbang, take out our life insurance money for the biggest amount. And it will, if we shoot down, we could stop gang violence. They will make sure you will remain alive.
Really, really strong point. And I just want to dial back a little bit. That's a powerful point, though, the life insurance. I just want to dial back a little bit to when you mentioned that the fact that the communities do have money and it's really an issue of priority and what we make it important. A comment coming through here from Facebook from Joel is we focus on the wrong things and we spending on the wrong thing. You know, we spend on things that are fleeting but there's a line from a song, right? There's a line that I wrote for a song called Real, and it says, you know, you dress up in designer to forget your poverty.
Yes.
Because that is what the media continues to give you as the antidote to your suffering. You dress up nice and the suffering would stop, or you wear a hairstyle that you saw one of the celebrities wear and the suffering would stop. But it is not lasting.
Well, as Bob Marley said, they're belly full, but they're still hungry. You know?
Very, very,
and
very
the
much
research
so.
shows, not to cut you, Xavier, that 75%, and I want everybody to check it out, 75% of the things in your house you don't need to live. 75% of the things in your house you don't need to live comfortably. That big screen TV you have, that big dining set, that you don't need that to live. That's not living. That's being a consumer. That's being addicted to material stuff. I see big houses in Trinidad. Who cleaning them house?
How do you see that consumerism and that materialism playing into crime and violence, and how could the public health approach help address that?
The public health approach, remember, talks about the health of the community. talking about emotional, physical, spiritual health, not the material health of the community. Not the, you know, we focus on, you could have all the money in the world, but if your health is poor, you ain't worth nothing, right? And so one of the things that, and I used to have discussions with my young folks who will come into my office dressed up with name brand stuff. And I will go and buy the non-name brand stuff looking just like them. And they think that how I buy name brand. And I say, how much you pay for yours? It's 500. How much you pay for yours, Uncle Ulric? $20. And I look the same.
There's
So
a comment from Facebook here that supporting what you say about what we need. I know someone is saying, yeah, it's true. This is Auntie Joanne here on Facebook. She said, I research and throwing away the rest.
yeah.
Yeah, so much.
You know when you realize how much shite you accumulate is when you move in. And you find out, what the hell what did I buy this for? But you know that jealousy and envy I talked about earlier. Xavier built a one-story house. I as a Tobago are going to do what? Build a two-story house. You have a 25-inch TV. I gain a 35. You see what I'm saying? I have no money to, I'd rather save up my money, have a TV and eat bread and water, but I'm making you know I'm bigger than you. You know what I'm saying? That mentality got to change. We have the money in the community. We got to prioritize. And because check this out. If you're spending, I use this formula, time plus energy equals power, right? If I spend my time and energy working to get something that's going to give me that external validation, I'm wasting time and energy, right? And if I can't get it, I get frustrated. I'll go and teeth it, right?
Yeah.
Which is a false sense. That's what the brother was talking about, having to pay that tax. You see what I'm saying?
Speaking of that tax and ways we could possibly mitigate against it, I'm seeing a question here. What rites of passage for those children at the age between 10 and 12 as a cultural tool can be used to socialize them into responsible teens and adults?
I think Dr. Muhammad could speak about the Torah Center, and they have the rites of passage. Africans had rites of passage, right? We step away from that, where the Eurocentric man is defining the black man. He is defining the rites of passage for young folks, right? They say black culture does not exist again. It's artificially created by those in power and sold to us, right? They tell us what black culture is. They want to tell us who our black leaders is, right? And we buy it. So back then we had rites of passage. We have rites of passage groups here for black boys here in most of the universities have, have rites of passage for young black boys where they go through pathfinders. My brother is the big commander of the pathfinders. They have rites of passages, right? Where they own badges and stuff, Boy Scouts. There's certain, that's why gangs are successful. They have a rites of passage,
Yeah.
in order to join gangs.
What do you think are some of the steps that neighbors could take in communities to help mitigate risk factors of them falling victim?
Come together, like, for example, communities here in neighborhoods in Boston, they do what neighborhood watch, and they do neighborhood walks, right? So you will have in Dorchester a police officer, the community police officer, minister, get off from your church, probation officer, psychologist, medical doctor, social worker, all come together and walk the neighborhood. And walk some of the most dangerous neighborhood. Because the most dangerous, we are afraid of our young children, right? And you walk the community and you see Xavier in the corner and you're like, Xavier, and you walk that every weekend. So you become part of it. And you say, hey, Xavier, come on, what's going on? What, you into music, man? Well, I know such and such as a music studio, you know. I could see if we could. That's what they could do. It don't cost money. It costs time and energy.
Yeah.
Which is more powerful than money.
Very much so. And I think it's
gangs will do it. Gangs do community walk. They'll walk down the street and they'll see Xavier. Hey, Xavier boy. Yeah, but you know, it's very transactional. Xavier, I will help you if you help me. Very transactional, right? And we have a lot of programs that operates like that. You know, I'm gonna help you if you do this or do that. So neighborhoods could get together. You know, Xavier, we do it. When come to Christmas and Carnival, differences gone aside. We share the same bottle of rum and we wind up on each other. After Carnival, we go back to the same thing. Even gangs call troops. You know what I'm saying? We have the ability. You know, yeah, because it's not me to judge your son or your daughter, right? Because what I'm pointing fingers at you to say, I have 4 pointing back at me. Because you never know.
Right.
So it's that mentality that we need to go back. We need not, Trinidad and Tobago need to stop being a hypocrite. When you say together we aspire, together we achieve, mean it now. Mean it. Just don't say it. Words are cheap. You know, my wife always tell me, don't tell me you love me, you know. Show me.
Show me. Yeah.
She's a behaviorist.
Totally agree.
They say love is an adjective, it's not a noun. Huh?
Yeah. In that vein of being intentional and taking the necessary steps.
Right.
What action plans do you think could be drawn up to help us solve this crime issue and what may already exist as well that we could tap into?
So
as a community?
As I said earlier, there's good things going on in Tobago. We need to tap it, gather the data, and show it. Because if it was not going on, Xavier, you would have more than 40 homicides. You see what I'm saying? But we don't talk about that. Do you know we had more billionaires during COVID than before COVID? Created, right? People are making money off of this crime stuff. Tobago have a lot of good things going on. We need to research it, create the database. There's a lot of programs. There's a lot of, you know, Camille and Xavier and Safety Net in little pockets going on. Remember, you asked me what caused this move in Boston? Young people. There's a lot of young people doing good things in Tobago, man. Big them up. Don't let one small minority of people define Tobago.
Powerful point that we totally agree with you on.
Yeah.
You know?
Use the media to big them up, man. Big them up, man. Big up at these Xaviers and everybody. And that would, for example, when we had gang violence and tagging, remember they used to tag and spray the wall? We had graffiti. We had graffiti. We had young people going around taking out the graffiti and drawing nice art. You talk about art. If you come to Boston, you will see beautiful art all around. Afrocentric art. Oh, if you live in that environment and you turn and you see, rather than graffiti. When I first went to New York and I saw the amount of graffiti, I got scared. Back then, no go to New York now. Hardly any graffiti. So communities that takes the wall as a canvas. In fact, I wanted to go around and take some of those pictures and make a calendar of it and sell it as a fundraiser. Beautiful art. And you got young artists out there. We also have community concerts where young up-and-coming artists could perform. What it does, it gives the community a different look of you. When we demonize young people, we're demonizing ourselves.
Agree.
Right?
That's
I mean, big up, I mean, it's like, Domingo is my thing. You know, this guy was going to do. What's his name? That Quincy. You know,
Quincy, yeah, big love to Quincy for coming through and making that transition in his life and then
yeah,
paying it
man.
forward by and yeah,
Remember,
for
remember,
sure.
he mentioned a book, the Frederick Douglass book, The Miseducation of a Black Man.
Yeah,
Right?
correct.
Education, ignorance is expensive in America. I
Yeah.
mean, and we have, and I live in the United States. I taught at Harvard at the doctoral level, and I used to give bullshit lectures and see these doctoral students taking it down. The lack of critical thinking scared me. The
Oh.
ability to think for yourself is not encouraged. In the
You know, it's
school
not
system.
taught.
No.
No, it's not taught to be system at all.
Yeah.
It's really not taught, and it's important to get in wholesome human beings because everyone has value and everyone has something special inside of them that they could share.
Yeah.
But
Well,
if we keep creating robots and regurgitators, then whatever is put out in the media is what we live. I
that's why I
see that.
challenge organized
We
religion.
see.
Yeah. And because we all created and by a creator and he don't make junk. You know? But
Yeah.
so I think that the public health model again is based on collecting data, analyzing that data, and operating from facts rather than perceptions. Right? We were talking earlier about police officers chasing certain members of the street, and so you have no homicide for 40 days. That's a delusion. That's a delusion. We want permanent change, not symbolic or temporary change. And I think that's what Tobago Civil Net is looking is, I don't want my child to just behave when I'm present. I want him to behave well when I'm not present also. If somebody behaves,
that internal guidance system
yes,
working.
yes. I think Quincy talk about your constitution, right? When he was in jail and the man challenged him, it's like you're looking for outside validation and definition. Define yourself, you know? But we could create schools. We could create centers. I think Dr. Muhammad does that at the Kwame Ture Center. Rites of passage, teach martial arts.
Yeah.
I'm a black belt in martial arts. That helped me with my confidence, right? I don't need no gun, right? Sense of self-worth, value. We those are things we call it social emotional learning. We had those in school. I don't know if they have it in school where you have where you learn to cook and build houses and back in the day and keep a house. Do they still have those things in school?
I think some schools still have the programs running, but priorities, it's not really high on the priority list of many of the education institutions, at least the formalized educational institutions. But those things are important for character development, not just for skill development.
Yes.
So
yes. I mean, again, and I think since COVID up here, a lot of parents are homeschooling their children because they realize with COVID, my child having a master's degree in da 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 da, but don't know how to cook, iron, wash your clothes, or whatever. Those survival things are important. I mean, and in my youth program, I used to inspect bedrooms. Where you live should be clean and organized because a cluttered room is a cluttered mind, right? All of those basic instincts and stuff help to prevent youth violence. Showers. I remember back when I learned how to take a shower, how to bathe properly, um, Today, these young people don't know. I used to run a young boys group. I say you dress up nice, but you smell and stink. You know, after shave and perfume on
They don't
dirt,
know
you
how
don't
to
smell good enough. Yeah. So we have a lot of people dress up going to a party, but no hygiene. You know, a dirty body is like a dirty mind. You know, if you don't clean it,
Mm.
it creates issues. So,
We have a question here.
mhm.
Um, if the community have a lot of finances that can be funneled towards the work, have you seen examples of effectively helping communities to reprioritize fixing crime by redirecting their own funds? Have you seen those examples?
Yes, we see it here in Boston. The one the for example, my youth program, since I believe education itself, um, and one's culture and one's heritage is so important, and thus the 5 C's: color, culture, class, character, and context, is a model that I use, even a new form of therapy that I use. Having a people feeling good about their color, their culture, even the class, which talks about power, about the uniqueness and the community.
Mm,
You know, we have discussions about that over and over again, right? If I don't feel color, the sea of color symbolize things about me that I can't change. I'm a Black man, heterosexual man. I need to feel proud of that, right? And if I feel proud of being a Black heterosexual African man, Trinidad and Tobago man, and I really dig into that, I will walk proudly, and I will respect the Jamaicans who are hope. I want him. It's not pride over, it's pride with. You follow me?
yeah.
You know, then the other one is you have culture, the same thing. Trinidad and Tobago culture is rich if we know from whence we come. And in spite of oppression, we invented something called the steel pan. I am still fascinated with it. But we have so much self-hatred, we won't even put it on a damn flag. Right? But if I feel good about my Trinidad and Tobago culture, yes, we have issues. You remember Trinidad is bad. I don't know why they speak it bad. You know? Do you know we have so much violence in the United States, but you'll never hear the United States speaking bad of the United States. You know? They always big up the United States as one of the best countries in the world. Yes? You know? The other one is, so you have culture, you have class. When I was raised in Trinidad, I didn't have latrine. I didn't have a toilet. I didn't have indoor plumbing. Class has to do with power. I knew I had the power to define myself. And to me, that was more powerful than money. Right? And the other one is character. I'm an identical twin. But no identical twin have the same fingerprint. Just knowing that I am unique. There's nobody like Ulric Johnson. Nobody. My mother made me know, although you have a brother that looks like you, talks like you, your fingerprint and his fingerprint is different. You are unique. Man, I get up in the morning and I look at my unique self and I can't help but smile, right? And then you have the issue of context. Context is everywhere, anywhere you're at. I think in spite of some of the things I've gone through as an early child in Trinidad, there's some positive things that I learned from my mom and my culture that will make me allow me to survive anywhere in the world. We Trinidadians, Trinbagonians could survive anywhere. We got them in Alaska, anywhere, because we have some fundamental things that even though we act up, we have some we got to get back to it though, right? that we could instill in our children as foundations that will let them, you know, the foundation is the most important part of a house, right? If that foundation is solid, the house could blow away, but you could rebuild back on the foundation, right? Our foundation these days are being attacked, and we must defend it. If politicians and ministers they ain't doing it, it's up to me. It's not up to, I'm not waiting for a politician to take care of me. I and we as a community must take care of ourselves. And
Agreed.
and
I think that's
I
very
have worked,
important.
yeah, I've worked with gangs and turned gangs around. The Crips and the Bloods started as a community group, like the Black Panther movement, but they got caught up in money, and the government used that to split them. You know, create confusion, introduce that jealousy and envy rather than love and admiration. So let me tell you, I could go into any country and turn it around freeways by introducing, and they did it here in the United States with the Native Americans. They introduced drugs in the form of liquor, call it fire water. Then they introduced the gun, call it a fire stick. And the third thing they introduced was competition. That will destroy any community or any relationship.
The third thing they introduced was what?
Yeah, huh?
What was the third thing you said they introduced?
Competition. Competition. You do that in any relationship, marriage, football team. But remember, they introduced drugs. They used to smoke pot and they had their own drug, but they had cultural regulations. They introduced a foreign drug, alcohol.
With no regulation.
Right. Introduced crack cocaine and cocaine. They had bone arrows, right? And spears. They introduced what? Guns. Right? And then the next thing was competition. They did the same thing in Tobago and Trinidad. You know?
Yeah.
Back in the days was
so you have to hold strong to the foundation and reintroduce those foundational elements that secure the community.
Yeah.
That you mentioned. You know?
Those foundations were the
yourself.
protective factors. Those foundations were using the public health model. Those foundations, right? The right foundation. There were some foundations that we thought was good foundation that we realized it was not. Foundation that is introduced by the oppressor is not to our benefit.
Yeah.
Right?
Filter. Yeah, we don't throw away the whole thing, we filter it.
We good.
What program? When you say foundations, right? What programs can parents turn to help redevelop those foundations?
So
you know, because especially
now. One of the things is, what? You're kind of can you hear me? So there is one of the foundation that a parent could do is love for herself, their self, mom or dad, and love for their children. So I use the acronym LOVE to mean the L means to listen, the O means to be open, to hear things from your children, even things you may not want to hear. V is to be vulnerable, and the E is to empathize. So listen, be open to your children, Be vulnerable with your children and empathize with them. I think that's a foundation. Learn the love language of your child. I don't know if you're familiar with love languages. There's 5 love languages. Some people need attention, material goods. They need physical touch, time alone. Each child is unique. Learn the love language of your child and love them, because you may think you're communicating love, but they're not receiving it. I do that in marriage and family therapy. I have couples learn the love language of each other. Get involved, as Camille has talked about. Get involved in your child's school, their friends, their clubs. If they're performing, go see them. Get involved. My mom used to play cricket with us. She used to pitch. She used to pelt mangoes. She was involved in our lives. My brothers and I are a musician. I have a rhythm section and a pan side. My mother played in the band until she was 91. Okay. Her instrument was a scratcher, when she got older, and the most important thing is to role model. Role model the behavior and the person you want to see your child be, right? The old saying that we used to have back in the day, do what I say, not what I do, is a bad way of raising a child, And the old saying, children are to be seen, not be heard. Oh my God, that ideology, that foundation is a weak foundation, because today our children want to be heard and they want to be seen, and they're doing things to be heard and seen, right? If they were really felt they were being heard and seen at an earlier age, they wouldn't go to these drastic means to be heard and seen. So basically, loving and role modeling. I mean, but I challenge moms and dads to love themselves. You cannot give me love if you don't have any. You cannot teach me to be respectful if you're not respecting yourself. Daddy, you can't tell me to listen to my mom when you're beating my mom. You know what I'm saying? You can't tell me not to swear when you're swearing. That I remember kids are developing this. The first example of what it means to be a man is your dad. The first example of what to be a woman or a wife is your mom. And so parents are very influential, and then they go to school, and if the teacher is acting like your mom and your mom is not acting appropriate, it gets reinforced, right? Remember, the influences was parents, church, and then teachers, right? Now children are looking for their peers and the media to define what being a man, a woman, a husband is, and that's a setup. And we have to take responsibility for that.
I agree.
Yeah.
It sounds like good parenting. It sounds like good parenting is also key to building these 5 C's as you have listed.
Yeah.
And some local parents don't have the skills to do it well. But
So
I think what you just outlined in terms of the self-esteem development, not just for your children, but for yourself, and learning with them and about them, and really seeing them as really strong points to help alleviate some of those challenges of feeling like you're not seen, or you're not heard, or you're not important, you're not special, and therefore you're looking for attention and you're looking for ways, and that could go very far.
Yeah, but when I was growing up in Trinidad, parenting is learned skills, right? You're not you could be a mom or a dad. To be a father or a mother, you have to learn parenting skills. It's very key. And so that's one of the things that we have here in Boston that goes towards ending violence. teaching. When I first came to Trinidad in 2008, and I was talking about masculinities and working with children, I was hard on stopping corporate punishment. And because corporate punishment is a repeat of what the masters did to us, right? And because it's culturally practiced doesn't mean it's right, right? Slave was a cultural practice. Slavery, it doesn't mean it's right. And I was on a radio show talking about why can't we talk to children rather the first thing is to beat them? That's the master thing. The master won't talk to the slave. He beats them. And I was walking downtown on Frederick Street, and a man said, I saw you on TV and I heard you on the radio, and he started crying. He said, maybe it's too late, but when my daughters were young, I never once considered talking to them. I immediately go to beating them. And I said, it's never too late. They're grown now, let them know and apologize, because they're going to go try and beat their children. Because their role model of what being a parent is you. It's intergenerational.
And the culture of violence continues.
Yes, but we have to stop it. Each one of us could say, no, I'm not going to do that. You'll get into trouble, though. You know, I've gotten into trouble for not beating my kid. You see you? You see? Yeah, no, yeah. You see that? Yeah, your children. I have a son who's 48, who's a manager of a thing. My daughter is a manager in a hospital.
Yeah, that wasn't necessary. There are different ways to help them.
Yes, yeah. But that's the culture of violence. So if I beat he grew up a beat your wife. And you, where you learn that from, boy? I see you beating mom every day.
Yeah.
That's the social ecological model.
Thankfully, as you said, it's never too late. And I'm grateful I had the opportunity to have conversations with my own mom about it. It was very, very challenging of a conversation to have. It was a conversation that in many ways she didn't want to have, and parents wouldn't want to have it. One, it's normal, it's acceptable. Two, sometimes even as we grow older and we learn differently, sometimes we don't want to face the ways we went wrong. Never happened.
Right.
We don't want to address it. But not addressing these problems is some of the things that lead to the increase in crime and the violence that we're seeing right now. Because many people do come to an awakening and realize. And, I just want to take this time now to as we come to a close, to just say thank you to everyone who was tuned in, and to ask you, Doc, if there's any final words that you will have for the audience tuned in, both here on Facebook and on the Zoom call, and everyone who has went along the journey with us, because you have as well, you've tuned into the sessions as well, Doc. So I turn it over to you to just share any final thoughts on the whole series and how Tobago, how we could move forward.
Definitely, I wanted to, again, encourage and challenge Tobago CivilNet to continue this work, because one of the main concept of the public health model is education. If you have the protective factors, as I said, ignorance is very expensive and deadly. Is to continue having forums like this and educating the community. And I challenge Tobago people to educate each other. Back in the day, we used to listen to our grandmothers tell the stories, about Sukunya and all of those stories had the foundation of morality, and in a cultural way, teaching kids social emotional stuff. The public health model is a cheap model. It doesn't cost that much money because we have the money. Government, there's things that government needs to do. Government needs to reallocate funds equally. The criminal justice model is one model. And we, as I said, you know, there's room for it. But if somebody is ill, if a community is ill, you try to find out what are the protective factors of healing that community, right? Rather than locking up. You can't lock up a whole community, right? I want to end with a poem, if I will, talking about art and stuff. I know if people heard it. It's called, and I'll go back. Children learn what they live. If children live with criticism, they learn to condemn. If children live with hostility, they learn to fight. If children live with ridicule, they learn to be shy. If children live with encouragement, they learn confidence. You could replace children with any human, okay? But I'm using children, okay? If children live with shame, they learn to feel guilty. If children live with tolerance, they learn to be patient. If children live with praise, they learn to be appreciative. If children live with fairness, they learn justice. If children live with security, they learn to have faith. If children live with approval, they learn to like themselves. If children live with the acceptance and friendship, they learn to find love in the world. So we need to attack it at two levels, from the adult and from the children. Those are the protective factors and the risk factors of violence and crime in Tobago. I want to thank Tobago CivilNet, you, Xavier. Thank you for the conversation. You're a great host. And I look forward to meeting you guys in person in beautiful Tobago. And I do believe in together we aspire, together we achieve. And I know we got to go back to that foundation. Blessings to everyone.
Thank you so much, Dr. Johnson, for being here with us this evening and sharing your perspectives, everything that you would have learned along the way, all the initiatives that you would have implemented, and shown us how it could be relevant in our space here in Tobago. And I need to add poet to your to the introduction.
But you know, as an artist, art gets the point across. You know what I'm saying? I mean, yeah, music, media. Yeah. Thank you.
I want to also say thank you to all our audience members, those who have been with us from the very beginning 1 month ago, as we started this series, those who have made it this far with us, or even those who have tuned in for the first time this evening. Tobago CivilNet is committed to doing the work necessary to help evolve our society, to help re-implement those aspects of our foundation that made us strong, that gave us hope and faith and resilience, and to expelling the elements that are damaging that foundation that we need for the future. I want to also say thank you to our sponsor, Eastern Credit Union, for their support in this initiative. We look forward to working with each and every one of you, of the presenters who came and shared with us, from Dr. Johnson today, to Camille last week, to Dr. Mohammed before, as well as the tenors, you know, Quincy Joseph, for you all coming and giving so willingly of your time and your energy. This is not the end of this conversation. This is not the end of this work. This is simply the close of our series. We will continue to engage with the community. We will continue to do the work required. We are looking forward to your support. We need your help as a community, as a people. Everyone tuned in here, you know, tell someone about the work Tobago CivilNet is doing. Tell us about the work you are doing. Tune in with us on Facebook or Instagram at Tobago CivilNet. And you can always check us out also at tobagocivilnet.com and our website, www.tobagocivilnet.com. We look forward to working with you in the future. Big love to everyone tonight. You all have a blessed evening. Do take care.
Thank you.
Welcome.
But in a minute could get real scary. Open your eyes. Let me tell you where we come from. Trinidad and Tobago Islands. And we not even Jamaican, but the dancehall scene, yeah, we shut down. And everything, yeah, irie. But in a minute could get real scary. Anywhere we go now, missing people on the news. And the boy them on the floor now. Blood running, can't stop it. Flow, boy gunning, small rocket. Woo, black life and a small topic. No, police outside then not stop it. No, try tell me that is part of it. No. And I want to share with you tonight. There's still beauty in our eyes. Open your eyes. Let me start with the roots where we come from. Africa, brought to a paradise island, Bago. Peaceful people, but real radical. Warrior, heart clean, pretty like a rainbow. Link up with a sister isle named Trinidad, West Indian. Beat the pan, I know you know the name though. Come and take a lime and a wine for carnival. Have a lemonade and unwind in Tobago. In Tobago. Tobago, Trinidad and Tobago. Tobago, I love you so. Tobago, I love you.